seen some votes for both the Bible series and the anatomy series. And we're actually just about to round out our section in the thorax here. So I thought we could go ahead and do that by reviewing, it's got some sectional anatomy that's actually going to lead into some radiography, so some clinical imaging of this region that we've been talking about for the last several videos. So we'll get into that here shortly. But first of all, apologies for the delay over the last few days in getting videos out. The changing of the weather all the time, sometimes it'll knock me flat on my back. So I had a brief illness. I'm good to go. I'm back to feeling right. So just had to get back on my feet, and I'm glad to be back all with you all. Thank you to those of you who continue to subscribe because you like these videos. I really, really cannot overstate my appreciation for it. And beyond that, for those of you who take the time to like these videos, that helps get these videos out to other people who may also find them interesting. So if you haven't subscribed yet and you'd like to, I'd love that. If you want to send it on to a friend who might carry the same interests in ASMR or some of the topics that we're talking about within ASMR, I appreciate that so much. I don't take that for granted. Now, with that, I guess, call to action out of the way, let's go ahead and get into what you all actually came to see. So we've got sectional anatomy of the thorax. So we've got a few cross sections and specific looks that they're going to give us here, and then we're actually going to get into the images that they're providing. So in this image here, we've got an inferior view, so we're at the bottom looking up into this cross section, and it's showing us here, it's pretty much cut through the trachea, the esophagus, the major pulmonary or major blood vessels here at the top. So it's just above the level of what looks like the ascending aorta. It's just above that. So let's take a look here real quick. So we're at here's the front of the body, because here's the manubrium part of the sternum. So we know this is the front of the body, we know this is the back of the body, and we know we're looking up into from the bottom. Here, for orienting, here is your esophagus and your trachea. Here's your brachiocephalic trunk and your brachiocephalic vein. So again, if there's any confusion, whenever you're looking at most anatomical figures or pictures, it's going to be reverse orientation. So here's my left hand, and this is on the right, so everything's going to be flipped because, again, we're looking at it this way. And here's your left brachiocephalic vein, your left common carotid artery, and then, as you might remember from some of the previous videos, there's that first rib, which tells us that that's where those features are going to be. Here's the phrenic nerve running down to your diaphragm. Here's your left vagus nerve running almost concurrently with it. The left subclavian artery. Here's the second rib. And the sympathetic trunk running right along the spine and indicated here. So we actually know exactly what level we're at. The T3 vertebrae. So that tells us exactly where we're at. And then we are in the superior lobe of the right lung and the superior lobe of the left lung. So we're not quite at that at the fissures yet to differentiate the different lobes. All right, and now in figure 11.2, we've got the transverse section through the mid region of the thorax. And let's see if it tells us what vertebrae we're at, so we know exactly what level. We may not be so fortunate. It may just be kind of an arbitrary cut through. I don't see it, and that's okay. That's okay. So we've got we can see we're in the heart here, because here's the right ventricle. Here's that costomediastinal recess that allows the lungs to expand into it. Here is the superior lobe of the right lung. Here's that horizontal fissure. So that actually tells us that we're probably about midway down the rib cage in this cross section. Here's the right atrium, the right middle lobe of the right lung. And then again, on the left lung, you're just going to have the superior lobe and the inferior lobe. There's that oblique fissure, seen in both. There's the thoracic duct, the descending aorta, because again, we're lower down, so we're past the arch, and it's already looped down. So again, don't allow these pictures to be intimidating. It's just a different vantage point on what we're looking at. And the reason that cross sections like this are valuable is because whenever we get into some of the imaging, it's going to look just like this. And I'll explain why that is when we get to it. But these cross sections, they're looking for when you know the baseline anatomy, where these features are, what these features are, what they look like. Whenever radiologists are doing reads on any radio imaging, you can pretty quick, or you with some expertise, could dial in to see if there's anything atypical, whether that be cysts, tumors, any kind of internal bleeding, any kind of symptomology that they're trying to rule in or rule out of their differential diagnoses when they're trying to ascertain the clinical finding. Let's see if there's anything else that's really worthy of note at this level in comparison. Really the biggest difference is that here we have a full vantage point of the heart, and we also have all three lobes of the lungs as opposed to just the apical portions in this picture. Alright, so coronal section through the heart. So this is going to be just basically another type of cross section, and the coronal view is more just cutting it right down the middle, or cutting a slice down through it. Trying to think of the words that they just escaped me. From top to bottom, if that's helpful. Hopefully more words will arrive to me soon to give you a better descriptor. I'm sorry. So here's your ascending aorta that's transected, the pulmonary trunk transected, the left ventricle, and the right atrium. And this is an anterior view. So there we go. That's the word. That's the word I was looking for. And then here's an inferior view. So looking up from the bottom, here's the right ventricle. There's that very thick interventricular septum. The left ventricle, that tricuspid valve. And remember, tri indicating three flaps or three cusps in the valve. The mitral valve, so it has two valves. There's that ascending aorta. There's the esophagus. So that's a pretty cool view, looking bottom up. And then the pleural recesses. It's a transverse section, superior view. So we're looking top down. And we've got the anterior mediastinum right here. So this is the front of the body. There's the sternum. The internal thoracic arteries and veins. The serous pericardium, the parietal layer. So this is kind of what's encapsulating the heart. Inferior vena cava. Let's see. What else do we want to highlight? There's the parietal pleura. The central tendon of the diaphragm, of course. There's that thoracic duct right through here. It's creeping through. The azygous and hemiazygous veins coming up to that superior vena cava. There is the parietal pleura, and that is going to be the mediastinal portion. Here's your costodiaphragmatic recess again. Here's your phrenic nerve, and then your pericardiacophrenic and arteries and veins. I almost had to go out of my way to say that one due to my struggles with that word in the previous video. So, if you've been watching these for a minute, that was for you. Alright. And now we're getting into the imaging itself. So, and we'll go through this in just a second. So there's a variety of different views that it's going to give us, and I'll try and walk through each of them one at a time with you. So we have the radiographic appearance of the heart. Here is the superior vena cava. Here is the ascending aorta. Here faintly is the aortic arch. There's the pulmonary trunk, and this is pretty fascinating because we're looking at an X-ray here, so it's pretty incredible that we can get that just from this. Without having to do really intense imaging, that we're able to get this from that. Here is your right atrium, your right ventricle, your left ventricle, and your left atrium, because again, the orientation of the heart is not straight up and down, it's thorax is down here. And here's your left ventricle, of course. So it says anterior, posterior chest radiograph, anterior view. So it's an anterior view, and the X-ray was done with the radiation of the X-ray going from anterior to posterior through our patient. Here's a lateral left lateral chest radiograph. So patient is turned to the side, they're facing this way, and the radiography or the radiation is going through the patient. So here's the trachea, the aortic arch, seen very faintly right here. Here's the sternum for orientation purposes, and that leads to the anterior mediastinum. There's that cardiac apex again. Interestingly, we can see the main bronchi, and you can almost see kind of the carina right here, that little V structure where they fork, the bifurcation that takes place. Here's the posterior mediastinum and the diaphragmatic domes. So you could probably, if we were to really look close or even have better resolution with an MRI, we could probably see the central tendon right here. Alright, and here's a left bronchogram. So we're getting imaging of, whether or not there's any occlusion or issues for the patient. More often than not, something like this would probably occur to rule out a pulmonary embolism, but it also might be a byproduct of imaging to see the severity of pneumonia if someone's come to the if they're hospitalized with pneumonia. So here's the apical posterior segment, and if you remember, let me see if I can get back to it. That's not the right page. Here's a little bit of page turning for those of you who like that. Here we go. The bronchopulmonary segments. Those are going to be, and you can see them here, the different segments that supply or receive. One more time. They have the air exchange that takes place of the receiving of oxygen that takes place at these different levels. So we've got the anterior segment of the upper lobe up here, the lingula of the superior segment of the upper lobe, the lingula of the inferior segment, the segmental bronchi, the anterior medial basal segment of the lower lobe, which is pretty incredible that they can make this out from just a standard, or from imaging, from this kind of imaging. Superior segment of the lower lobe, and then the posterior basal segment of the lower lobe. Here we have an MRI of the thorax, which is pretty incredible. So an MRI, for those of you who aren't familiar, it's magnetic resonance imaging. And basically what happens in an MRI is that a very powerful magnet is kind of strode around the patient, and it causes movement of the electrical particles within your cell, and the magnet impacts that, and it allows contrast to be drawn into an image. It's a process more complex than what I can get into in this video, but just to give you a general idea of how they get the imaging, there's not a usage of radiation. It's just a very, very powerful magnet, and because of that, patients that get an MRI, if they have a pacemaker, they have to have the pacemaker approved. If they have any kind of implants, those have to be approved, which most medical devices that are inserted are now, but every so often, you just never know. So they always double check for that reason. But seen here is your spinal cord, which is pretty incredible to be able to pick that up. Right pulmonary artery, here's your right main bronchus, your right pulmonary vein, here's your right lung, just in general. Here's the liver, which means that the diaphragm is going to be running right along here. Here's your spleen. We haven't talked about that much. T11 and T12 right here. Here's your esophagus, which I am fascinated that they were able to make that out, but I guess you can kind of see the muscular structure of it. Left pulmonary veins, left main bronchus, left pulmonary artery here, your aortic arch coming off of the heart, and then your left lung. Alright, I'm actually going to flip back here real quick to kind of go back and forth between the surfaces of the heart and the chambers. And so we're looking at some coronary angiography. And so basically what's taking place in these images is they are checking the blood flow going through some different major arteries of the heart to rule out blockages or occlusions to see if stents need to be installed, especially if the patient has had chest pain or if they've experienced a heart attack. They want to identify where the heart attack has taken place, because the clinical name for a heart attack is myocardial infarction, and infarction is blockage. So, that's what we're looking at here. So we've got the left coronary, or let me show you here on the heart. Let me try and find a good comparison so that we can orient ourselves. So we've got the left coronary artery. What picture is going to show me that the best? Let's see. Did I go back too far? Because I want to give give you all a valid comparison point to orient ourselves where specifically we're at. Here's the coronary sinus. Left posterior lateral, left diagonal, left interventricular. Alright, so here's the interventricular sulcus. There's the left ventricle. This is posterior interventricular sulcus. So it is going to be in this general area here. So we've got the left coronary artery, the left circumflex, the left marginal, the left diagonal, and the left interventricular, as well as the left posterior lateral. Let's see if I can find, so the right coronary. I'm bummed that I can't find a better picture that immediately applies. I had tried looking beforehand, but sometimes things don't just work out the way you want right away, and that's just life. But that's okay. We'll continue on. So you've got the right coronary artery and the right marginal artery, the right posterior lateral artery, and the posterior interventricular artery. Now, this here is showing us the pulmonary trunk and the ascending aorta, so we should be able to find that pretty easily. So our orientation of the heart is actually, in this case, should be pretty close to just like this. So the heart is tilted forward in this imaging just a little bit. So we've got the right auricle, which would be here, the ascending aorta, which is going to be here, the pulmonary trunk, and the anterior interventricular branch of the left carotid artery running through here, which it's pretty incredible to get that kind of arterial, or that resolution on the arterial structures. Left pulmonary veins, left coronary artery. Here's your left auricle. So it looks like the heart's kind of tilted down and over from some of the images that we've seen. There's that circumflex branch and then the marginal branch. Here's an MRI of the heart, and this says left ventricular outflow. So we're going to be looking down into the left ventricle and what's coming out of it, or what's it feeding into. So here's the left ventricle, and then coming up out, going into the ascending aorta. Here's your brachiocephalic trunk. Here's your pulmonary artery in the general area. Here's your right atrium, which means that, just barely visible is your right ventricle. And there's that thick interventricular septum. Here's a two-chamber view of the right ventricle. So here's the right pulmonary veins. There's that superior vena cava, so receiving blood going back down into the right atrium. Here's the tricuspid valve, which is going to be your cutoff point of dealing with blood going into the right ventricle. So deoxygenated blood coming through that superior vena cava, the right atrium, it waits a beat, and then it comes in through the right ventricle, and then it goes to be oxygenated. Here's your pulmonary trunk, your ascending aorta, which is that blood is coming out from the left ventricle. And then there's your brachiocephalic trunk again, so just a different view. Pretty incredible that we can get this imaging, and it looks just kind of like blobs and masses if you don't know what you're looking for, but once you're oriented, you're like, well, wait a second, this is pretty incredible. Aortic arch angiogram, left lateral view. So we got our right thyrocervical trunk, our right common carotid artery, our right vertebral artery, our right subclavian artery that can be seen here, granted very faintly, but pretty visible, is the brachiocephalic trunk, and that aortic arch is, very prominent. Ascending aorta into the aortic arch, down into the descending aorta into the thorax. Here's our left common carotid, and then our left subclavian, and then our left vertebral, and the left thyrocervical trunk. And then, let's see, we got one last set of images here. So we'll look at this CT of the thorax. So what's noteworthy with the CT is I already kind of explained very basically the idea of the MRI, but the CT is, it stands for computerized tomography. And what you can think of with a CT is basically it's also it's a big tube that the patient goes into, but it's much wider. And the radiation of an CT is much higher compared to an X-ray because a CT is basically just a ton of X-rays being done on a patient at once. There are these I'm trying to think of how to explain it in a way that makes sense and that isn't too in depth. There are sensors all around the CT that fire out radiation in the same way that an X-ray is done, much more simplistically. A CT does complexly, because it's basically a bunch of X-ray transmitters all around this loop that hit the patient with radiation. But the contrast between the CT and the X-ray is that extra radiation is utilized to get very good contrast imaging, and then the CT layers them on top of each other so that it's just a bunch of slices. It's like a very, very complex medical cake where you can kind of go through the patient slice by 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 slice and see exactly what's happening at each level, and if there's anything that's amiss. Again, going back to the idea of internal bleeding or a tumor or a cyst or anything like that, you can go through level by level and identify, okay, what are we dealing with? What's atypical? What's baseline? And get really get into it. So here is our CT of the thorax. We've got a rib here. We've got the anterior edge of the lung in the costomediastinal recess. There's that superior vena cava. And here's a right main bronchus. Here's our pectoralis major, actually. So we get a little bit of the musculature. We can pick up on the CT. There's the sternum. And there is the ascending aorta, the left lung, the left main bronchus, the descending aorta, the scapula, the subscapularis, and the infraspinatus. So we're getting some of the musculature in here. Now, a quick note about CTs versus MRIs. A general rule of thumb, not always directly applicable across the board, but CTs are known for being very good with picking up on bony structures. They're utilized in different ways, of course, but if you want to rule in or rule out a fracture on a major bone or anything like that, CT is often the way to go. If you want to rule in or rule out a ligament tear, like an ACL or an MCL or something like that, you're probably going to get an MRI. So if you want to see if you broke your knee, then you'll probably get a CT of your knee. If you want to see if you tore a ligament in your knee, you're probably going to get an MRI of the knee. But that's a quick aside. ascending aorta here, superior vena cava here, right pulmonary artery, right inferior lobar bronchus. Here's your pulmonary trunk, your left pulmonary vein, your left atrium. We can actually faintly make that out. Left inferior lobar bronchus. Here is your esophagus, very faint. Azygous vein, and your descending aorta. And then we actually can make out the heart pretty well at this cross section. Here's your right auricle, your conus arteriosus, which is fascinating to be made out, the ascending aorta, the left ventricle, the left atrium, the esophagus, the left pulmonary vein, and the descending aorta. And then one last final set of images over here. We've got the right atrium and the aortic valve. We've got the conus arteriosus again, the left ventricle again, the left atrium, the right pulmonary vein. Here's the esophagus. Here's the descending aorta. Here's the left pulmonary vein. So if I wasn't clear on these two, it looks like we've got an inferior view looking up at the base of the heart because we see the descending aorta here, and we see the ventricle probably with a little bit greater clarity than the atrium. So the heart is going up this way, kind of like this orientation. So your ventricles are down here. We're seeing those first, and then the atria are up here. Here is your right ventricle, your right atrioventricular or tricuspid valve, the right atrium, the left atrium, the esophagus, the interventricular septum. And so this is a different vantage point on the heart, descending aorta, and the sympathetic trunk. Alright, I think that's it. And then what we have next section is going to be the abdomen. So exciting to enter into a new section, or exciting to me, hopefully exciting to you all too. And it's broken out into the surface anatomy, the abdominal wall, the abdominal cavity and spaces, the internal organs, which that'll be a whole section unto itself, the neurovasculature of all these different structures, and then the section on radiographic anatomy, just like what you're all used to. So, as always, thank you for taking the time to watch with me. I do not take everybody watching for granted. If you want to see more of something, let me know. If you'd like to see if I can tweak something, please leave me a comment. I read every comment, and I'm constantly doing what I can to improve the content that I'm putting out for everybody. So, thank you for watching, and I think next might be a Spanish video, or it might be a Bible video. We'll see what I'm feeling. But either way, thank you for taking the time to watch, and we'll see you next time.